Computed tomography, CT or CT scan, ranks as one of the top 5 medical developments in the last 40 years. CT has proven valuable as a medical diagnostic tool that the 1979 Nobel Prize in Medicine was awarded to the inventors. However, did you know that CT delivers some of the highest radiation doses used in diagnostic imaging? Did you know that in the United States alone, CT has been estimated to cause around 6,000 cancers a year, roughly half of them proving to be fatal? A 2004 study in a U.S. teaching hospital found that three-quarters of the referring physicians and even radiologists didn't know that radiation doses in CT are as high as they are. Fortunately, there are steps that can be taken to eliminate unnecessary CT use, one of them being paying proper attention to the dose issues. So, how does CT work? Both CT and conventional X rays take images of internal body structures. While in conventional X rays the structures are overlapped, in CT imaging the overlapping structures are eliminated, making internal anatomy more apparent. During CT imaging, an X-ray tube rotates around the patient so that multiple images are collected from many angles. These images are stored in a computer that analyzes them to create new image with overlying structures removed. This allows radiologists and other physicians to identify internal structures and provides detailed information about the medical problem. So how much dose does one get from CT scan? When it comes to radiation dose from CT, it depends on the type of procedures and the parts of body being examined. Potential risk can be expressed in different ways. Radiation dose can be compared to levels from naturally existing radiation in the environment or an effective dose. Effective dose is the dose quality that is used to assess risk from diagnostic medical imaging procedures. It takes many factors into account, including sensitivity of different body organs and tissues. It is expressed in millisieverts. To compare natural background radiation dose to medical imaging, we compare imaging dose to the time it takes to reach the same dose from natural background radiation. For example, our dose from natural background radiation in 1 year's time is approximately 3 millisievert. We have compiled a following list of summary for radiation doses for commonly performed CT procedures. Abdomen and pelvis, 10 millisievert or 3 years of natural background radiation approximately. Head, 2 millisievert or 8 months of natural background radiation approximately. Spine, 6 millisievert or 2 years of natural background radiation approximately. Chest, 7 millisievert or 2 years of natural background radiation approximately. Angiography, 12 millisievert or 4 years of natural background radiation approximately.
Through the use of computed tomography, experienced radiologists are able to diagnose many different health issues with extremely high accuracy, producing faster treatments and eliminating the need for more invasive diagnostic procedures. CT can reduce the risk of serious complications such as a burst appendix or ruptured diverticulum and the spread of infection. CT procedures are quick and easy, providing detailed images of tissue, lungs, bones, and blood vessels. CT can reveal internal injuries and bleeding quickly enough to save lives and can be performed with an implanted medical device of any kind, unlike MRI. CT enables radiologists to perform minimally invasive procedures like needle biopsies and needle aspirations, particularly of the lungs, abdomen, pelvis, and bones. A diagnosis from CT scans can eliminate the need for surgical procedures as well. While CT is painless, non-invasive, and accurate, it is linked to leukemia and brain cancer. Since CT uses radiation in the form of ionizing radiation, technologists run the risk of overexposing their patients if the CT scans are not performed correctly. Ionizing radiation has sufficient energy to damage any living tissue in the human body. Even though the body attempts to repair the damage, it may be too severe and widespread to be repaired. Since there is no safe dose of ionizing radiation, technologists need to be extremely careful when performing CTs, especially since CT delivers a higher dose of radiation than your typical X-ray. Large population studies show a slight increase of cancer from large amounts of radiation, but there is no evidence that radiation amounts given in CT cause cancer. The expected benefit of CT outweighs the potential risk from radiation when recommended by your doctor. Since children are most sensitive to radiation, they are more likely to only receive a CT scan when it is necessary to make a diagnosis, and no repeat should be done unless it is essential. Overall, the benefits outweigh the risks of CT. As long as the exam is performed correctly and the appropriate precautions are taken, the patient should benefit and not be harmed.
At Cedars-Sinai Medical Center in Los Angeles, California, doctors were furious when hearing that patients had received 8 times the normal dose of radiation during a brain scan. About 40% of the patients who were overexposed had the initial signs of radiation overdose. One was from a patient who reported she had hair loss following a CT scan. Having this much exposure can cause hair loss and redness of the skin. This is the first stage of the acute radiation syndrome. Doctors believe that this would affect almost all of the patients in the future with problems such as cancer, but the patients who were over the age of 70 years old would have a very small risk of having long-term effects. The reason for the overdose was unknown, but the FDA is taking steps to help minimize radiation exposure from computed tomography, but Cedars-Sinai claimed that the CT machine had not been checked for over a year and it was a malfunction. This is a video from the news broadcast for the Cedars-Sinai CT overexposure.
Continuing education is very important for a CT technologist who continues to work in the field. They need to understand how the machines work, what the appropriate dose is for each exam, how to do the exam, and if there have been any advances to better perform the exam. While it is very important for the technologist to remain current with the advances that have been made, it is also important for the patients to receive the education they need to understand why they are having the test and why it is beneficial to them. Through the negative media attention CT has received, many patients are skeptical of any imaging diagnostic testing because of the links to cancer. They are automatically scared and do not realize that the benefit to having the scan done could be higher than the risk of not having it. They need to be reminded in a positive way that there are good aspects such as it being fast, painless, non-invasive, and accurate. Those 4 qualities allow for the patients and doctors to immediately decide what course of action they want to take in the medical care. While other tests may eventually give the same result,